Hello everyone, I'm Dr. T. Today we are going to uncover the real story behind the food pyramid. The one we all learn in school and why it may have quietly contributed to the health crisis that we are seeing today. This is not about dieting, this is about understanding how our food system has changed and why it must change again.
The story begins in the 1970s. At that time, Western countries were facing a major health crisis, heart disease. Scientists believed dietary fat was the main cause. In 1992, the United States Department of Agriculture, known as the USDA, officially introduced the food guide pyramid. Its message was simple: fat was dangerous. Carbohydrates were safe. So carbohydrates, bread, rice, cereals, were placed at the base of the pyramid. The intention was good, but the science was incomplete. When this model reached Malaysia, it fit perfectly into our daily life. Rice became the main focus of every meal. Breakfast, lunch, dinner, nasi, roti canai, mee goreng, kuih. Sweet drinks became normal. Because fat was considered harmful, carbohydrate intake increased. But the human body does not run on belief. It runs on biology. Modern science later discovered something critical. Refined carbohydrates, such as white rice and sugar, rapidly increase blood glucose. The pancreas responds by releasing insulin. When insulin remains high repeatedly, the body becomes resistant to it. This condition is called insulin resistance. Insulin resistance is now recognized as the root cause of type 2 diabetes, belly fat, fatty liver disease, and abnormal cholesterol. The old food pyramid never considered this mechanism. For decades, fat was blamed. So food manufacturers removed fat from products, but something replaced it as sugar. Low-fat yogurt, low-fat milk, low-fat snacks all contained higher sugar. Later research showed sugar increased triglycerides more aggressively than fat. Heart disease did not disappear. Instead, metabolic diseases increased worldwide. The enemy was not fat alone. It was excess refined carbohydrate.
By the early 2000s, doctors around the world began noticing something worrying. Patients were following the guidelines. They were eating low fat. They were avoiding oil. They were choosing what we told them was healthy. Yet, they were becoming sicker. Diabetes appeared earlier. Fatty liver disease increased. Obesity continued to rise despite of low fats, and something didn't make sense. Clinic after clinic, years after years, the numbers kept climbing up. So by 2010, the old food pyramid could no longer be defended. And what happened in 2011, it officially retired. An era has been ended, but nutrition didn't stop there. So in its place, they introduced a new model introduced by USDA, but refined by our Harvard School of Public Health. So no longer a pyramid, but a plate. So the focus has changed, not just how much we eat, but what we eat. It matters what we eat instead of how much we eat. So vegetables and fiber become the foundation, and adequate protein was prioritized. Healthy fats were no longer the enemy. Refined carbohydrates were reduced. For the very first time, the nutrition begin to match our human physiology. And that change would reshape how we understand our food forever.
Today, Malaysia is facing a silent epidemic. It does not arrive with sirens, it does not make headlines, but it is quietly changing lives. Nearly 1 in 5 adults is living with diabetes or prediabetes. Many do not even know it yet. This is not about looking thin. This is not about dieting trends. This is about survival. For decades, our bodies have carried the burden of excess sugar and refined carbohydrates. The damage has been slow, invisible, and cumulative. The new food pyramid is not a fashion. It is a medical response to a nation under metabolic stress. And the solution does not begin with extremes. It begins with small, deliberate choices. Half the plate filled with vegetables, a quarter with protein, a quarter with rice, less sugary drinks, less silent harm. These simple changes reduce the strain on insulin, protect our organs, and preserve years of healthy life. Because prevention is not dramatic, but its impact is profound. The future of Malaysia's health depends on what we choose to eat today.